clinical vignettes focused on Listeria monocytogenes, each with 5 answer choices and detailed explanations, including why the incorrect choices are wrong. Question 1. Transmission and risk groups. A 30-year-old pregnant woman presents with fever, chills, and muscle aches. She reports eating unpasteurized cheese while traveling abroad. Blood cultures grow a gram-positive rod that shows tumbling motility at room temperature. What is the most likely complication of this infection? A. Neural tube defects in the fetus. B. Fetal macrosomia and hypoglycemia. C. Spontaneous abortion. D. Congenital limb abnormalities. E. Polyhydramnios. Correct answer C. Spontaneous abortion. Explanation: Listeria monocytogenes can cross the placenta and cause amnionitis, spontaneous abortion, or granulomatosis infantiseptica, particularly in early pregnancy. A. Neural tube defects are associated with folate deficiency, not infection. B. Fetal macrosomia and hypoglycemia are complications of gestational diabetes. D. Congenital limb abnormalities may result from teratogenic drugs or amniotic bands. E. Polyhydramnios is due to fetal swallowing defects, not listeriosis. Question 2. Immune evasion mechanism. Listeria monocytogenes avoids immune detection by which of the following mechanisms? A. Secreting IgA protease. B. Producing a polysaccharide capsule. C. Inhibiting phagolysosome fusion. D. Using actin-based motility for intracellular spread. E. Forming spores in hostile environments. Correct answer D. Using actin-based motility for intracellular spread. Explanation: Listeria uses actin polymerization to create rocket tails, allowing it to move from cell to cell without exposure to antibodies. A. IgA protease is used by Neisseria, S. pneumoniae, and H. influenzae. B. Listeria is non-encapsulated. Capsule-based evasion is seen in S. pneumoniae, H. influenzae, etc. C. Inhibition of phagolysosome fusion is a feature of Mycobacterium tuberculosis. E. Listeria is not spore-forming. Spore formation is seen in Bacillus and Clostridium species. Question 3. Clinical presentation. A 72-year-old man with a history of diabetes and chronic kidney disease presents with headache, fever, and altered mental status. CSF shows elevated protein, low glucose, and increased neutrophils. Gram stain shows gram-positive rods. What is the most likely organism? A. Streptococcus pneumoniae. B. Listeria monocytogenes. C. Neisseria meningitis. D. Haemophilus influenzae type B. E. Cryptococcus neoformans. Correct answer B. Listeria monocytogene. Explanation: in older adults and immunocompromised patients, Listeria is a common cause of meningitis, especially when gram-positive rods are seen on CSF gram stain. A. S. pneumonia is also a common cause but appears as gram-positive diplococci, not rods. C. N. meningitis is a gram-negative diplococcus. D. H. influenzae is a gram-negative coccobacillus, not gram-positive. E. cryptococcus is a yeast, best seen with India ink or cryptococcal antigen test, not gram stain. Question 4. Microbiology and diagnosis. Which of the following best describes a distinguishing laboratory feature of Listeria monocytogenes? A. Grows only at 37 degrees Celsius. B. Produces black colonies on tellurite agar. C. Exhibits tumbling motility and grows at refrigeration temperatures. D. Is an obligate intracellular organism. E. Produces sulfur granules in infected tissue. Correct answer C. Exhibits tumbling motility and grows at refrigeration temperatures. Explanation: Listeria grows in cold environments, cold enrichment, and demonstrates tumbling motility in broth culture. Key diagnostic features. A. Listeria can grow at 4 degrees Celsius, which helps in food contamination, e.g. dairy, deli meats. B. Tellurite agar is used for Corynebacterium diphtheria, not Listeria. D. Listeria is facultative intracellular, not obligate. Obligate intracellular organisms include Rickettsia, Chlamydia. E. Sulfur granules are characteristic of Actinomyces israeli.